Hi, this is Dr. Beyer again. I want to spend a couple minutes today going over a little bit about thyroid conditions. You've been getting some emails from me, you've been to one of my workshops, or you've received one of our DVDs. Just a couple minutes today that I want to go over the #1 cause of thyroid dysfunction, of underactive thyroid in the United States, is an autoimmune condition known as Hashimoto's thyroiditis. It is very much underdiagnosed. If you've been diagnosed with underactive thyroid or hypothyroidism, you have an 80% chance that this is what you have, an autoimmune condition called Hashimoto's, but you don't know it because your doctor doesn't run the antibody tests to look for it. And the reason why they don't run those antibody tests is because it doesn't really matter. Their treatment is the same no matter what type of underactive thyroid you have. It's kind of a one treatment fits all type treatment. So we know that there's multiple pieces to the thyroid dilemma, and I want to go over one of them today. Now, what happens in autoimmune thyroid is that your immune system is making a mistake and it's attacking either an enzyme in your gland called thyroid peroxidase, or TPO, or the little protein messengers that carry the thyroid hormone around in your body. When this happens, your thyroid mechanism will not work 100%, and therefore you'll suffer all the symptoms of underactive thyroid: fatigue, weight gain, lots of sleep, hair loss, etc. Cold hands, cold feet. Now, what happens, without getting too technical, is normally in our immune system we have our white blood cells make up our immune system. We have T helper cells #1, T helper cells #2. These T helper cells #1 are the cells in our immune system that attack a germ. T helper cells #2 are the white blood cells that will tag the invader, the intruder, and form antibodies against that intruder, so that if you're ever attacked again, or if that intruder ever invades our body again, it can handle it in a more efficient manner. This is what happens when we're vaccinated, for example. Now, in any autoimmune disease, what will happen is that there's a lack of communication between these two halves of the immune system. So you'll get one side of the immune system firing or working too high, and the other one not working enough. And that will cause your immune system to act funny and to attack self. This is what happens in all autoimmune disease. So what we do clinically is, the way that we treat with functional medicine underactive thyroid, is we're going to find out why this would happen in your body. And there's multiple reasons why. The most common causes of an autoimmune attack on your thyroid are poor blood sugar, where your blood sugar is going too high or too low, or both. Gut infections will do it, or any chronic infection or viral infection, for example. Food sensitivities and leaky gut syndrome. So #1, you need to be diagnosed properly. That's what we do in our clinic. #2, we need to find the triggers to your autoimmune condition, if you have it, and remove them. And we find great success in helping people to get their lives back when we do this. Thank you, and we'll talk soon.